This hospital serves about 400,000 people in the area, has 120 beds, and only 4 local doctors. And they don't all work together. At any time, there will be only 1 local doctor in the hospital. This is where we come in. My name is Reut. My husband Eitan and my son Eyal living and working here in Kiboga for the past year almost. We came here because this has been our dream for a long, long time. We wanted, after we get our medical education and we can be more helpful, to come here and work as doctors in a small rural hospital. Here as one person you can make all the difference in the life of a patient. You can be the difference between actually life and death, dramatic as it sounds. And it's it's a good feeling because sometimes you see a patient coming out of the hospital and you know that if you weren't there, he would have died. Every month we see in the wards in the hospital about 300 people, and in the outreach about 150 more patients. This is a big impact to the people of Kiboga district. So SBI is a road construction company. They actually go way back, have a long history in Uganda. They built this hospital in the 60s, which is and many other hospitals in Uganda, and which is a pretty impressive build, lasting until now.
SBI donated money to us that we feel is going directly to the place that it is needed most. The people who can afford the private medicine, the private doctors, the private facilities, they don't need all that money. The people here, they don't have money even for food sometimes, and the money that we get from SBI goes directly, not to their pockets, but to their health, to the facilities, to the trained medical personnel that we bring and that we consult with, and to us, of course, as medical personnel, and to the equipment that they don't have here in the hospital, and we provide, and then they can get good basic medical services. And I think this is a rare thing, that money goes directly from one place to the place that it needs the most. And we appreciate it very much, every day. Every time we give money to a patient, every time we buy another thing for the hospital or give medication, we appreciate the fact that we have the possibility even to do it.
I don't think many people can say that they are living their dreams and also making a difference in people's life. And I feel this past year has been that for me and for my husband. And we have SBI to thank for, because without them we wouldn't have been able to come here, and we wouldn't have been able to work in the wards and bring things that are needed for the patients. And this is something that for us it's meaningful, and I'm sure for every patient we've seen here is very meaningful. So thank you to SBI for enabling this for us and for the people of Kiboga. The wound in the leg was very infected. Wasn't feeling so well. She was treated for a long time with antibiotics. We were cleaning the wound from all the dead tissue.
There is a way they have lifted us as a hospital. So, and to me and the entire staff and the entire leadership of the district, we would wish that this program continues, given the developments that have come to the hospital through this partnership with the SBI and the hospital.
We are thankful to SBI RCC for the tremendous support it has extended to the people of Uganda, because not only is it involved in the construction of roads and other forms of infrastructure, but has also invested through corporate social responsibility in other areas, especially areas which affect the common person, like the field of health, where SBI RCC has supported doctors in the Kiboga hospital who not only carry out curative services within the hospital, but also carry out extensive outreach programs in the wider community around Kiboga to help the population with sensitization and giving information on the basic diseases which affect the population.